Hello everyone. Today we will discuss about the topic osmosis. So before starting my lecture, I just want to remind you that you can use the notes on this topic as I provided in the description link. Okay, so let's start it. So what is osmosis? So osmosis is a diffusion of water from a hypotonic solution to a hypertonic solution when the solution are separated by a semi-permeable membrane. So as you can see in this picture that there is two solution, 1, 2, and this is separated by a semi-permeable membrane. So what is the function of semi-permeable membrane? That the semi-permeable membrane allows some particle to move across each other like water. The semi-permeable membrane allows water to move across each other. So where water will move, okay, so the water moves from a hypotonic solution to a hypertonic solution. So what is hypotonic solution? The solution which have less particle is called as hypotonic. Okay, this is hypertonic, more particle. So whenever the solution is separated by a semi-permeable membrane, then water will move from a region of hypotonic medium to a region of hypertonic medium. Okay, and the force that diffuses water are the osmotic gradient. If you ask me to summarize the osmosis in a simple word, so just remember hypo to hyper. You will see in my future lectures that how many times I will use the word hypo to hyper. Let's apply the concept of osmosis to understand the pathology of diabetes mellitus. So what is diabetes mellitus? So in diabetes mellitus, there is a lack of insulin. So the lack of insulin is either due to the decreased production of insulin or due to the decreased activity of the insulin receptor. So due to the lack of insulin, the glucose can't able to enter inside the cell. We know that the insulin regulates the entry of glucose into the cell by a GLUT4 transporter. So if there is a low insulin, then glucose can't able to enter inside the cell, and the concentration of glucose started to build outside of the cell, and that makes that medium hypertonic as compared to the inside of the cell. Here you can see in this picture that because of the low insulin, the glucose started to accumulate outside the cell. Okay, and there is very less glucose inside the cell. Okay, so what will happen if the glucose started to accumulate outside the cell? So we know that our cell membrane is a semi-permeable membrane. So in this case, the principle of osmosis started to take place, and the water started to move from a region of hypotonic solution to a region of hypertonic solution. So in this condition, this medium is a hypertonic medium, and this medium is the hypotonic medium. So water started to move from inside the cell to outside the cell, okay, because of the osmosis. So what are the consequences we see in cell because of this shift of water? So because the water started to diffuse out of the cell, it leads to a cell shrinking, and it shows the symptom of polydipsia, polyuria, and polyphagia. So let's understand this. Okay, so as water moves from inside the cell to outside the cell, it leads to a shrinking of the cell, and when water gets accumulated over the extracellular fluid, then what happens? That excess water comes out in a urine, and we call it as a polyuria. Okay, we call it a polyuria. And when there is less water in the cell, then it causes a polydipsia, that is the urge to drink water, and polyphagia, that is the urge to eat something. In this case, glucose acts as an effective osmole of the extracellular fluid, because as the level of glucose started to build up in the extracellular fluid, and this glucose can't able to enter inside the cell because of the lack of insulin, so that makes the glucose an effective osmole of the extracellular fluid in case of diabetes mellitus. As we can see in a normally situation, as I discussed in my previous lecture in body fluid distribution, that the plasma protein are an effective osmole for vascular compartment. As I discussed in my previous lecture, that the plasma protein is a large molecules, so it cannot able to move from the vascular compartment to interstitial compartment. So the plasma protein in a normal situation is an effective osmole of the vascular compartment. Just like that, the sodium is also an effective osmole for the extracellular compartment, because it needs energy to move the sodium into the intracellular compartment. Okay, that's why sodium is an effective osmole for the extracellular compartment. Let's discuss some question to solidify the concept on osmosis. So in this question, a red blood cell of 400 milliosmol is placed in a container full of NaCl solution, and the osmolarity of the NaCl solution is also 400 milliosmol. So what will be the effect in RBC, whether it shrinks, swell, or there is no change in RBC. Okay, so as I discussed just now, that the sodium is an effective osmole of extracellular fluid in a normal condition, that is it cannot able to enter inside the cell, okay, in a normal situation. Okay, so what will happen in RBC? So you can see the osmolarity of both medium is same, so there is no osmotic gradient takes place over here. Okay, there is no osmotic gradient take place over here, so there is no osmosis will take place here, and there is no change in the RBC. Okay, let's discuss the other question. Okay, so in this question is same, just the osmolarity of NaCl is changed. So if so, the osmolarity of the NaCl is 200 milliosmol and this is 400. So this is hypotonic medium and this is hypertonic medium. So where will water move? Water move from hypo to hyper. So that is RBC swells. Next question. In next question, the osmolarity of NaCl solution is 600 milliosmol. So this this medium is the hypertonic medium and this is the hypotonic medium. So water will move from hypotonic to hypertonic, that is the RBC shrinks. Okay, next question. In this question, the osmolarity of both medium is same, but there is a urea in place of NaCl. Okay, so we know that urea is not an effective osmole of extracellular fluid, that is this urea can able to move inside the cell in a normal situation. So in this condition the osmosis will not take place. Okay, the osmosis will not take place. The movement of water will depend upon the quantity, okay, upon the quantity of water. So you can see that the quantity of this solution is more, so water started to move inside the cell, that is the RBC will swell. Thank you very much.